Hi, my name is Dr. Amee Daxini. I'm a dermatologist and I practice in my clinic called Think Skin Clinic in Bangalore. I'm also the founder of Go Skin Positive skincare products. I'm a specialist in aesthetic dermatology and my preference is skin regenerative dermatology, where I deal with anti-aging, not just the procedures but also the products. So today we're going to talk about the botulinum toxin. Some also call it the neurotoxin or Botox. So I'm going to use the word Botox for the botulinum toxin. How does this work? It's a very simple process in which the Botox is derived from a bacterium. It's a protein which, when enters the muscle cells, causes the muscle to relax. It prevents one active ingredient called acetylcholine to work on the muscle, and that prevents the muscle from contracting. So it is just a temporary paralysis of the muscle where the Botox is injected. So today in social media and all around the world, there's a lot of talk about baby Botox or a preventative Botox. Now, what is this and should one do that? Let me make you understand first, what do you mean by baby Botox? Now, this baby can have two meanings. One is that the baby means you start very young in life. And second is where you use less number of units. Now, as a dermatologist, I would recommend that understand first your skin. Don't think about your age first, but look at the skin age. If you start noticing fine lines or wrinkles developing, and here you need to differentiate between fine lines and wrinkles. Wrinkles are the lines that develop when the muscle moves, like the frown over here or like the smile lines over here. That develop due to movement of the muscles. These lines need to be treated if they affect you. But look at the laugh line. Now, these lines do not form due to muscle movement, so a Botox will not work on these lines. The fine lines that you notice on the face are not due to muscle movement, they are due to skin laxity, and they will not get benefited by Botox. If you notice lines on your face which are due to muscle movement, yes, you should start your botulinum toxin or Botox injections. Age is immaterial. It's the skin age that matters. And what is preventative Botox? It's just that when these lines, which are dynamic or they are present only when you move the muscle, are visible, that's when you start doing your Botox so that the lines don't become static. And what do I mean by static? Static is that the line is present irrespective of when you move your muscles. Once a static line develops, Botox works, but not as well as when you would have started when the static line was not present. So baby Botox or preventative Botox is essential if you want to prevent those static lines. But remember, a low dose of Botox, if anybody recommends that, is actually not of any use, because if you reduce the number of units, the effect does not last longer and you need to take repeated sessions. So if you're wondering what is baby and preventative Botox and do we as dermatologists recommend, I would just say yes, if you do not want those lines later in life, and if you do, take the right dose of Botox from an expert and check what brand they are using and try and use the best brands available in India. So sometimes we're very confused between what is Botox and what are dermal fillers and are they the same? Now you need to understand that Botox, as I said earlier, are used for lines or wrinkles which are present due to movement of the muscles, whereas dermal fillers are used to fill up a space or volumize that particular area to get a lift. So for dermal fillers are used to reduce laugh lines, to create a nose, to make the chin. But a Botox is used for your frown lines, for your crow's feet, for your forehead lines, where muscle activity is in excess. The sport generally needs to be done twice a year, but there are other brands, if you do choose, you might need it 2 to 3 times a year to prevent those lines from becoming more prominent. So most people ask me this question, that is Botox necessary and is it very essential for everybody to do to prevent aging? And my answer is that no, absolutely not. Aging and what you want your skin to see and be is your choice. So if you feel that you are in love with those lines and wrinkles, especially the crow's feet when you smile. It gives you that kind of age or a wiser look. You need not do Botox. Botox is done only when you feel that you want to erase or prevent a line from coming. That's when you go ahead and do one. And remember, you can do it as many times as you want and stop it whenever you want. The skin does not sag in excess if you stop doing Botox. So don't worry. If you want those lines to be prevented, go ahead, find the right dermatologist and go do your Botox today. When I was talking about preventative Botox, what I actually meant was preventing the static lines from coming. Like if you look at this static line, this is very difficult to treat once it has appeared. So as the dynamic and static lines are different, it's important to do the toxin and relax the muscles before the appearance of the static line. Once we do it after the appearance of static line, the muscles do relax. You do see a tightening of skin and reduction in movement of the muscles, but many a times we notice that the line doesn't disappear.